Heart failure is a complex condition that affects millions worldwide, yet many people find it confusing and overwhelming to understand. Simplifying heart failure means breaking down what it is, how it impacts the body, and importantly, what signs and symptoms everyone should watch out for to seek timely medical help. Early recognition and management can significantly improve quality of life and outcomes for those living with this condition. Today, we are honored to have with us Dr. Kagita Krishna Chand as expert in cardiology who will help us unravel the mysteries of heart failure. Dr. Chand will guide us through the key facts, warning signs, and practical steps that can empower patients and caregivers alike in managing this important health issue. Dr. Kagita Krishna Chand is highly qualified MD DNB in cardiology and an experienced interventional cardiologist at Centini Hospital in Vijayawada. With extensive expertise in diagnosing and treatment of complex heart conditions using the latest minimally invasive techniques, Dr. Chand brings invaluable knowledge and practical insights to today's session. His dedication to patient care and advancing cardiovascular health makes him the perfect guide to help us better understand the heart failure and its managements. So, doctor, let's get started with today's questions. What exactly is heart failure and does it mean the heart has stopped working?
Thank you for the nice introduction. I am Dr. Kagita Krishnachan. I am working as a interventional cardiologist at Centenary Hospitals, Vijayawada. So, what exactly is an heart failure? So, day and night we see so many cases of heart failure. If there is 100 OP, nearly about 20 to 30 patients we deal with heart failure daily in OPD, and also in IP department. You will be seeing about 10 to 20% of the people will be in the beds with heart failure condition. So
Yes.
what is exactly is in heart failure? So heart is a muscle. So the muscle contracts and it pumps the blood to the all organs in our body. So heart itself pumps blood up to 70 ml per each beat. So heartbeat is like 72 beats per minute. So it pumps up to 4 to 5 liters per every minute. When it fails to pump the blood to the vital organs, it is called an heart failure. It doesn't give the required oxygen or the nutrition to the cells, uh, and it will be inefficient to deal the condition. When we are walking and when we are having any like physical activity, the pumping capacity, if it is low, the pumping capacity is low, then the heart failure symptoms will be there, like breathlessness or any chest pain or any giddiness will be there. So these symptoms uh, should not be neglected, and we should reach the doctor and get the routine checkup done.
Thank you. What are the early warning signs of heart failure that people should never ignore, doctor?
Yeah, when the heart is not able to pump a sufficient amount of the blood to the vital organs, so there will be severe weakness. So there will be severe fatigue. The patient will be very tired and not able to do sufficient work, and he will be sleepy, drowsy, and sometimes he will be having chest pain due to the heart enlargement, and patient will be feeling very breathless, so not able to do or not able to walk routinely. And if he walks for a while, he may have breathlessness, and there will be like signs like pedal edema. So we will be seeing some swelling in the legs and also sometimes in the face also. So the main thing is, if you find any swelling in the legs, better to get an 2D echocardiogram done, and we should be evaluated for an heart failure. These are the major signs we should be looked after to get the best results.
Thank you. Doctor, you did mention pedal edema. So, pedal edema is always in heart failure, or there might be like this is for our viewers to understand that
No,
if
no.
they have
Just
pedal edema,
just having a pedal edema is not an heart failure symptom. There may be other entities like even protein is low in the body, albumin levels are low. Then we will having the swelling in the feet, and also you will be, if there is anemia, if there is hemoglobin levels low, then also we will be having edema. And if there is a thyroid problem, then also we may have edema in the legs. And if there are any fluid disorders, then also they will be having, and kidney problem, then also we will be having these symptoms. The main thing is there are associated symptoms with pedal edema. There are patient is not able to lie down. If he is able to take rest, he is not able to lie down properly. He will be having breathlessness while lying down. He
Mm.
might sit for it to get relaxation, or to get rid of his breathlessness. He should sit for a while to get the breathlessness down. And there are associated symptoms like palpitation. The patient will be having atrial fibrillation. There will be palpitation sometimes, and the patient will be having giddiness, and severe weakness will be there. Associated symptoms should also be looked after. Whether all should be there to have an heart failure symptoms. Just
Thank you.
pedal edema itself does not
Yeah.
denote heart failure.
Thank you for clearing our confusion for the viewers. Is heart failure the same as heart attack or something different, doctor?
So as I said that if heart is not able to pump blood to the other organs, so that is called an heart failure condition. So heart attack is something different. It is like if there are coronary arteries, there are blood vessels that supply blood to the heart. So if the coronary blood vessels are get blocked out, so there is 100% occlusion, then heart attack will come. So the blood doesn't go to the heart muscle, and heart muscle get injured, and we get heart attack. And heart failure is something that if heart attack it doesn't deal with heart attack emergency in an emergency situation, then slowly the pumping capacity of the heart comes down. Then it goes into the heart failure. So heart attack is one of the entity to cause an heart failure.
Okay. Can heart failure happen suddenly or does it develop slowly over time?
So heart attack can be of different types. Like heart failure can be like left-sided heart failure or right-sided heart failure. And so heart failure, there are entities like acute heart failure, like in acute conditions like heart attack and other conditions. So we may get acute heart failure. Patient suddenly go into severe breathlessness. There will be wall leakage, and he may go into severe breathlessness, go into heart failure. That is one entity. And chronic heart failure conditions will be there. Patient having hypertension or any kidney problem or any diabetes is there, and chronic conditions will be there. Chronic anemia, the so many conditions that are there. So slowly the patient pumping capacity get lower and lower, and patient will be having symptoms chronically, and
Okay.
it is a progressive disease.
Okay, noted. Who is most at risk of developing heart failure? Are there certain age groups or health conditions for it?
Yeah, heart failure we generally see in elderly people. If patient is more than 60 years, the prevalence of heart failure get increased. So, and there are other conditions like congenital heart disease. If there are any hole in the heart or any congenital abnormalities of the valves like aortic stenosis or mitral valve prolapse or with severe MR, and the patient is having any trunk problems, or a patient having any major artery problems, and patient having chronic diabetes or hypertension. So these are the conditions who are patient at risk having a heart disease. And in young people, we generally don't see heart failure, but if patient having congenital heart disease or any septal defect or having a any rheumatoid problem or rheumatic heart disease, and patient having any other congenital abnormalities, so and a patient having a young heart attack, so patient will be having heart attack in the young age, then we see heart failure in young patients also.
Okay. If someone has blood pressure or diabetes, can that lead to heart failure for them?
Yeah, definitely. If patient is having a high blood pressure, so the heart muscle get thicker, and pumping will be not efficiently done. So it goes on thicker and thicker, and there won't be efficiently pumping the blood, the heart. So then he goes slowly, progressively goes into the diastolic heart failure, and patient go into the heart failure. And diabetic condition, so patient is prolonged diabetic, the heart muscle get itself damaged, or due to the blood vessel damage or nerve damage, the pumping capacity of the heart get deranged, and slowly pumping capacity get affected and go into the heart failure. So we should get every heart diabetic patient or heart hypertension patient should get a routine checkup of ECG, 2D echo at least once in a year.
Okay. What lifestyle changes can help someone manage or prevent heart failure?
So main thing is the patient having risk factors like hypertension, diabetes, and if he is a smoker or alcoholic, and any thyroid problem is there, or any cholesterol problem is there, they should get a routine checkup like ECG, 2D echocardiogram done. So if a patient is having uh, like unhealthy habits like eating junk food or having beverages or having high carbohydrate diet, these should be curtailed down. So major thing is like regular exercise is a must from a early age. We should have a good lifestyle of having a regular exercise about 150 minutes per every week at least, or having a 25 to 35 minutes of walk or brisk walk daily, and we should have a adequate rest. And nowadays we see that. So much of stress has been increased in the patient population. So the stress control should be done like meditation, yoga, any relaxation exercises, hearing to a good music, or having a friendly atmosphere around. This should be done. And so other entities like we should curtail down the alcohol habit or the smoking habit. We should be avoided, and having a regular checkups like diabetic or hypertension checkups done, and thyroid checkups and cholesterol should be done for the prevention of the heart failure. And we should get an ECG or 2D echocardiogram according to our risk factors.
Okay. How often should a person with heart disease or other risk factors get their heart checked?
So we should get a regular checkup as early as like 20 to 30 years of age group. If patient is about 20 to 30 years, if having a family history of heart disease or having a sugar or blood pressure condition, so he should get a routine evaluation like ECG, 2D echocardiogram, blood sugars, hypertension checkup, and cholesterol checkup at least 1 year. So thereafter, if patient is above 30 to 40 years like that, then he should get an checkup like 3 to 5 years regularly. If he is having a risk factors and patient is elderly more than 50 years, then we should have a checkup like 1 or 2 years every checkup. And if a patient is already having a heart disease or having a heart failure condition, we should get a routine checkup of every 6 to 1 year regularly.
Okay. As we come to close of today's session on simplifying heart failure and what to watch out for, we extend our heartfelt thanks to Dr. Kagita Krishna Chand. Dr. Chand's clear explanations and expert insights have truly helped us understand this serious yet manageable condition in a simpler and more approachable way. His guidance on recognizing early symptoms and understanding risks and taking proactive steps have been invaluable. To our viewers, thank you for joining us. We hope this session empowers you to stay alert, informed, and proactive about heart health for yourself and your loved ones. Stay tuned for more sessions with leading experts and don't forget to follow us on social media for updates, health tips, and upcoming events. Until next time, stay heart smart and take care. Thank you, Doctor.
Thank you, madam. Thank you so much, Heart Mitra, for having this opportunity.